Now, my topic is aching bones at menopause. Why menopause? You can see 18-year-old girls come back and say, I'm having back pain, I'm having this pain, etc. But menopause is the age that we are looking at today. Every fourth or fifth woman seems to be having breast cancer. Even mild breast pain due to hormonal changes raises an alarm, and they come running to the gynecologist saying that they have pain, please check out, maybe cancer. And every woman undergoes mammography at least once in a lifetime. However, survival with breast cancer is high, almost 85% when it is confined to breast. With hip fracture, almost 25% die and 40% cannot walk. 60% require assistance after a year. Imagine if any elderly person at home or if one of you had to go through a hip fracture, it is devastating. Lifetime risk of dying from hip fracture is 2.8%, which is equal to the risk of dying from breast cancer, which is 2.8%. Yet, bone health does not get the attention that breast does. Breast gets attention from all sides, and poor bones don't. So we are looking at aching bones at menopause. I'm looking at this woman at the OPD today, Srija, 55 years old, complaining of persistent backache. She attained menopause 2 years ago. She has 2 children and has a tight schedule working in a software company, which you feel is very common these days. She's an asthmatic on inhalers and goes on tablets, that is steroids, when it becomes worse. On evaluation, everything is normal. What could be the cause of her backache? Could it be bone pain? Now, when I say bone pain, it could be pain or tenderness in one or more of the bones. Bone pain is different from joint pain or muscle pain, even though sometimes it is hard for an individual to identify one over the other. What are the causes of bone pain? Now, any fall, any injury to bone, or any of the fragility fractures, that is in a freak fall and then sustaining a fracture. That would be a fragility fracture. Or it could be due to osteomalacia, osteosarcopenia, or it could be due to infection of the bone due to any one of these reasons. It could be due to bone cancer, bone metastasis, and a host of other conditions. But I am going to limit myself to osteoporosis, that is fragility fractures due to osteoporosis, osteomalacia, and osteosarcopenia. Can osteoporosis cause bone pain? Can it really cause bone pain? No. Osteoporosis is a silent killer. By itself, it does not cause pain, but when it causes fragility fractures, it causes a lot of pain. Now, could this woman who I spoke to, Srija, can she be having osteoporosis? Now, look at the risk factors. She's 55 years. She attained menopause 2 years ago. She's on tablets including steroids for her asthma. So, these are all her risk factors. We know that glucocorticoids can induce bone loss, and unlike other agents that increase bone loss like thyroxine and PTH, etc., this causes an increased resorption of the bone. So when you put a patient on steroids, it causes resorption of the bone. COVID-19, which hopefully has left us, but it didn't leave us all that freely, because COVID-19, women who suffered from COVID-19 have a decreased bone loss of almost 8.6%. Osteoporosis is doubled in women who have been hospitalized for COVID-19. Severity of the COVID-19 pneumonia at the initial chest X-ray and the total steroid dose are predictive of which woman is likely to have osteoporosis. Therefore, bone health status has to be assessed in all women who have recently had COVID-19 infection. Can she have osteomalacia? What is the cause of osteomalacia? It's a lack of vitamin D or a problem with the body's ability to break down or use vitamin D. Bones become softer and are more prone to problems and injuries. The osteoid formation is defective, and therefore they are not good bones. Now, 85% of our women have low vitamin D. And what do you say about this? That is because though we have a lot of sunlight because of tropical zone, widely consumed food items such as dairy products are rarely fortified with vitamin D. Your milk packets may not show vitamin D. Indian socio-religious and cultural practice do not facilitate adequate sun exposure, gungat and all the stuff. Darker skin we have, therefore high melanin, so absorption of sunlight is poor. closely packed multi-storied buildings. Fortunately, I don't see them much in Thrissur, but come to Bangalore, you will see them all packed together. There's lack of space and limited outdoor activities. You rarely get to see children playing outside these days. Low calcium in the diet, high salt in diet, high phytate in diet, all these cause, and obesity, which is increasing very much now, all these cause a low vitamin D status. Now, what are the symptoms of osteomalacia? Muscle weakness. It's so vague that everybody could be having it, especially the pelvic girdle and a waddling weight. Bone pain in the lower back, pelvis and legs, and it's worse on weight bearing. It may be worse at night and after sudden movements such as turning in bed or change from sitting to standing. So many of your women might be complaining of it. You may not have identified them as due to vitamin D deficiency. Now, how do we diagnose this? Get a vitamin D level done if it is less than 15 nanograms, yes, low phosphate, low calcium, and raised bone-specific alkaline phosphatase. Now, alkaline phosphatase are from different sources. The bone-specific ones will be raised. Now, are osteomalacia and osteoporosis, are they same? Are they related to one another? Now, osteomalacia, the problem is demineralization, whereas in osteoporosis, there is a reduction in the bone density. Both are common in the adult age groups, but osteoporosis is more common in the very elderly. Symptoms are of muscles and bone pain in osteomalacia. Osteoporosis does not cause symptoms unless it causes a fracture. The cause is deficiency of vitamin D in osteomalacia, whereas there are a host of causes in osteoporosis. And the treatment is simple vitamin D in osteomalacia, whereas in osteoporosis, the only thing that I can think of is prevention in the form of healthy lifestyle and a lot of medications. Now, could this patient be having osteosarcopenia? What is this new terminology? Osteosarcopenia is musculoskeletal pain is a complaint of 50% of menopausal women. Sarcopenia is loss of muscle volume, muscle strength and function. How do you make out? You ask the woman to hold something, that is a grip test. Ask her to stand from a chair. Can you stand from a chair and see if you are able to stand without the support of the hands? Very simple test. Osteosarcopenia is decreased bone and decreased muscle function. So that is how this terminology has become very common and popular these days, because both of them, osteopenia and sarcopenia, together cause a lot of morbidity in the postmenopausal women. They increase the risk of falls, they cause fracture and a whole lot of problems including death. So we asked this woman to run a few investigations. In the meantime, she wants to know what food is good for the bones. Now, once she knows that something due to bones, she'll say, what food can I eat? Now, you know the calcium-rich foods, but why are we so obsessed with the idea of getting calcium from milk? That's because 1 cup of milk gives about 276 milligram of calcium. Say, round it off to 300 milligram of calcium. Whereas, if you look at sesame seeds, or if you look at the badams there, or if you look at tofu and orange juice and all, they have some amount of calcium, but the amount that they need to be taken is quite high. So much of 1 cup of almonds gives only 367. So, in all this, the simplest food that contains calcium would be your curds and your milk. What about supplemental calcium? Indian diet, should we be giving calcium to all of women, postmenopausal women? That's the question. Indian diets are poor in calcium. Supplementation with calcium is required for most of them. So you need to go through their diet, not necessary to prescribe to everybody. If they are taking adequate calcium in the diet, no need. What is the best calcium of all? This is something that everybody keeps talking about. Is it carbonate? Is it citrate? Is it lactate or phosphate? The best calcium would be probably calcium carbonate, because 40% of the elemental calcium gets absorbed. But the sources like the oysters and etc., they can have lead contamination. Other than that, they are good, they are inexpensive and the best form of calcium. They can cause a little bloating. Calcium citrate, 21% is absorbed. It is better, but it's more expensive. Same with calcium phosphate. Calcium gluconate is available in IV form also, but the amount that is absorbed is only 9%. And calcium lactate, 13% of that. All the other calciums are more expensive and much less absorbed. but they produce less side effects. So you choose which calcium according to the patient's pocket also. We inquire about her daily physical activity because we want to know how good a physical activity is. The only muscles that she is used to is the fingers that controls various activities, and the only weight that is being lifted is the body weight. So the benefits of being physically active has to be impressed upon our women. Healthier bones, better coordination and balance with those women who are physically active, improved muscle strength and flexibility, increased endurance for activities of daily living. Even our children get tired very quickly, but we don't, if you notice, because it's all the physical activity that we did during bone accrual that matters a lot. Improved posture comes with exercise. Now, what are the bone building exercises? There are two types. One is a weight bearing exercise where the weight of the body is transmitted through the bones. You're working against gravity here. It could be walking, it could be jogging, it could be climbing the stairs or dancing. Resistance exercise where the specific muscles are put into action. For example, weightlifting, free weights, etc. The tension and pressure transmitted to the bone through the weight bearing and the action of the muscles. Here both the muscles and the bones get strengthened, and this is called the ulsla. Now, how frequently should we exercise? Weight bearing exercise have to be done 2 to 3 times a week, and resistance training again 2 to 3 times a week. So on alternate days you could do this. There is no day off for exercise. Intensity, resistance training, 80% of the maximal effort. To that extent, you have to do it. And what is the duration? Weight bearing exercise is 30 minutes every day, and the resistance training exercise, you have to do 10, number 10, and at least 3 sets for each muscle. So one day you do the upper body, one day you do the lower body. Balance exercises are extremely important in menopausal and postmenopausal women. This helps to prevent falls, prevent fractures, particularly have to be done and easy to retrain balance. So one, you stand with the eyes closed, stand with eyes open first, stand with eyes closed, and a whole lot of other things. 5 minutes of balance training has to be done every day in order to reduce the falls. Isn't just walking enough? I go for walk, madam, half an hour every day I do. Is it enough? Brisk walking 4 to 5 times a week for 30 minutes is good for maintaining health. But on its own, it may not be enough for bone health. What exercises would we advise if this woman was to be osteoporotic? You see a thin, frail woman who is likely to be osteoporotic. Would you want her to do the kind of exercises that I just said? No, because those kind of exercises can cause problem to her. High impact exercises like jumping, jogging, and forward flexion exercises should not be able, because that itself can cause vertebral fractures. No using heavy weights, no side bending exercises, because pushing, pulling, lifting and bending, etc. She can do chair exercises. Sit on the chair and do simple exercises which will go a long way in maintaining whatever bone that she is having. This is an exercise session that we had in our society, and you will see all of us trying to balance on one leg, etc. Now, calcium is advised. What about vitamin D? Cholecalciferol, 60,000 international unit once a week. You all have become used to it, given for 8 weeks and once a month. Maintenance is 60,000 once a month or 2,000 international units a day. This is what we advise for. Now, there's so many things, vitamin D2, D3, cholecalciferol, ergocalciferol. The pharma fellow comes and shows various different kinds of vitamin D, and you get all confused. What are we talking about here? Now, exposure to the skin with the ultraviolet light causes 7-dehydrocholesterol, which is vitamin D3, causes vitamin D3. And the vitamin D3 that we take in our diet, it is called as cholecalciferol. Diet is cholecalciferol and ergocalciferol. Ergocalciferol from diet and cholecalciferol from the supplements that we take. All these get metabolized in the liver, and it causes and is converted into calcidiol. Calcidiol is 25-hydroxy vitamin D. This is what we measure when we check vitamin D in our blood. This vitamin D is what we check, 25-hydroxy calciferol. Now, because this is maintained for about 15 days, the values don't keep changing. Furthermore, it is in the kidneys that the active form of vitamin D comes, where another hydroxy molecule is added and it causes 125-hydroxy vitamin D. This is the active form of vitamin D. But the active form of vitamin D is not what we measure because it changes. Now, BMD, is it used? Have you ever ordered BMD for your patients? you need to go through the FRAX questionnaire. We have one specific for India. Going through the FRAX questionnaire, if it is high risk of fracture possibility, you straight away treat. If it is intermediate risk, that is where you get a BMD done and reassess the probability. And if it is of low risk, no need to get. But for all postmenopausal women who are more than 65 years and those less than 65 years with risk factors, you need to order BMD. Now, this is a young girl, 20-year-old, who has had premature ovarian failure. And therefore, it is very important that we start her on menopausal hormone therapy. This is extremely important, if not for anything else, so that she attains peak bone mass. At least till the age of natural menopause, you need to give, and if you are not giving, it is criminal. Oral contraceptives can be given, though we would prefer to avoid synthetic estrogens for some time. Estrogen in women with, I'll just take 1 minute. Estrogen in women with osteoporosis, it's reasonable to start under the age of 60 and continue it till the age of this one. It's an excellent hormone. That WHI studied spoiled it all. They did it on the wrong people and came out with the wrong results, and now the rest of the women have to suffer. We have better studies now which say that estrogens are very good in maintaining skeletal health. So it all begins the womb. This is the latest, this one in 2022, which says that how you manage the fetus in the womb, since we are all obstetricians, it's very important how we treat our fetus in the womb. A 10% increase in peak bone mass will delay the onset of osteoporosis by almost 10 years. Now, bone accrual happens in the 3rd trimester. Anything that affects the growth of the fetus in the 3rd trimester affects the accrual of bone. Please remember. Prematurity is a major reason for subnormal bone accrual. You can't say, I brought out a 1 kg baby, it is doing well. It may not do well 30, 40 years later, might die of osteoporosis. Subsequently, poor diet and lack of exercise augments poor accrual in childhood and adolescence. So ladies who are over 70 kgs, finally there is some good news for you. If you are over 70, the chances of osteoporosis very much reduce, 94% sensitivity. Prescription drugs, left, right and center. We prescribe rabiprazole, esomeprazole, etc. All those decrease the absorption of calcium from the diet because they reduce acid. GnRH, so all infertility specialists, please take care. She might produce a baby now, but she will land up in osteoporosis later because GnRH decreases the estrogen. Dipomedroxyprogesterone decreases estrogen and therefore the absorption of calcium. Heparin that is used in pregnancy, 30% will have decreases in BMD and develop fractures. So 10 ways to break proof our bones: diet calcium, catch the sunshine, 15 to 30% of the body surface area needs to be exposed, exercise, quit smoking, cut down on salt. It's very important because salt interferes with the absorption of calcium from the kidneys. Limit it to 5 grams a day. So we have enough salt in the food. Get a BMD done. Mind the medications that I told you all now. Enjoy a glass of wine, but don't go overboard. Less than 2 drinks a day. Cut back on caffeine. Make it less than 3 cups a day. And just say Om, meditate. Bringing down the stress itself can help your bones. Thank you, and thank you for the extra time.